The latest opinion polls supporting what Candy just reported, that President Obama is losing support for his health care proposals, and he's losing that support very quickly. The most recent CNN poll shows 45% of Americans disapprove of the way the president is handling health care, while 43% approve. Meanwhile, the latest New York Times CBS News poll shows the number of Americans who are very concerned their health care will worsen has soared from 28% just in June to now 41%. Perhaps one reason for the growing skepticism is there are a number of questions that haven't even been asked, let alone answered, about health care in this country. Like, what is the ratio of doctors to patients? Think about it. Have you heard that discussion? Well, in the United States, it's 1 to 416. On average, in other developed nations, it's 1 to 323. What is the biggest driver of healthcare costs? Is it medical technology? Is it pharmaceuticals? What is it? We haven't been hearing that discussion. It's medical technology, replacing older medical equipment with the newer options that are far more expensive but not necessarily more efficient or effective. And what is a reasonable percentage of our GDP to spend on health care? We spend fully 16% of our GDP on health care. Other developed nations spend far less. France spends 11%. Germany spends 10%. Canada also 10%. Why are other countries spending less? And what can we learn from their health care plans? These are questions that our, quote, representatives in Washington should be asking, but are not, and openly discussing with the American people, and are not, before any discussion of a health care overhaul can be rushed through Congress and then signed by this president. We will be doing just that on this broadcast. We'll be having a discussion about the key questions that should be answered and the answers that will affect your family. Some of those answers to these questions may come from other countries' health care plans. One such country with a high level of satisfaction with its health care system is Denmark. Most Danish health care is provided by regional governments at federal taxpayer expense. It is a lot cheaper than health care in this country, both as a percentage of the economy and per citizen. Kitty Pilgrim with our report on Denmark.
Denmark's health care is funded by the government, and it's responsible for collecting an 8% tax on income to pay for the service. Each of the 5 regions is responsible for running their own health care budgets, running their own hospitals, paying for doctor visits, treatments, nursing homes, and all other health services. Health care costs in Denmark are half of those in the United States. According to the Organization for Economic Cooperation and Development, Denmark spends $3,362 per person, and that is 9.8% of GDP. The U.S. spends $7,290 per person, 16% of GDP. Richard Saltman, who has written extensively on health care in Europe, says the Danish health care system is less expensive and less inclined to litigation.
All their physicians are in the hospitals, are public employees. They don't need malpractice insurance. Nobody ever talks about defensive medicine. That's not a term that would be used in Denmark in any form.
Personal service is key. In 1998, 90% of Danes said they were satisfied with their health care, according to a survey by the European Commission. That was the highest satisfaction in Europe. There are more doctors per patient in Denmark than in the United States, almost 4 doctors for every 1,000 people, versus almost 3 in the United States. Doctors in Danish hospitals are paid a fixed salary by contract. Primary care physicians are paid an annual amount for each patient and are paid additional amounts for more extensive treatments of severe conditions such as coronary care.
Denmark is also trying to reform its system. Now, some Danes are also buying private health insurance to cover extra costs such as drug co-payments, fees, and a better room in the hospital. But even so, the World Health Organization says that in Denmark, private spending on health care is only 16%, while in the United States, private spending is more than half of all spending on health care. Lou?
Yes, and I think it would surprise a lot of people to know that Denmark, with its universal care system, still, I think it's about 70% of the co-pays on dental and that sort of care is up to the patient. It is not a place where it's a safeguard against extraordinary and extreme and imprudent spending.
That's right. That's exactly right.
This is fascinating, and we haven't heard anybody else talking about these issues. We haven't heard this president, who is demanding health care be signed. We haven't heard this Congress, either Republican or Democrat, talking about these comparisons intelligently with other nations from which people can learn. And for one thing, with the issue that you bring up, malpractice.
Yes.
The discussion they want, I don't know what we'll see, but they want a public option, i.e. government health care, but haven't so far gained the courage to say, does that mean there would be no malpractice lawsuit brought by lawyers against doctors if it's a federal system? You know, these are not small issues, and this discussion is not taking place in public. It's almost as if the public be damned.
It's very enlightening to look at the different systems, especially on some of these points.
I'm glad you said that, because enlightening is what we're going to do here, Kitty, and you're going to do much of it. We're going to be bringing you the comparisons over the August recess here on the Low Dimes Tonight broadcast. We're going to show you what other countries are doing, those elements of those other nations' healthcare systems from which we can learn and which one hopes will benefit all of us here. Kitty, thank you very much. Outstanding. Kitty Pilgrim.